Hello, guys. It's your girl, Bianca, aka at Nurse Beezus on Instagram. And today I want to talk about a few things, basically comparing clinical experiences. I'm just going to jump right into the video. As you guys know, I'm currently in MedSurg 1 right now. I just completed Fundamentals, and Fundamentals is when we started going to clinical. And then MedSurg, we continue going on to clinical throughout, the program. But I wanted to share the difference in experiences with funds, clinical, and MedSurg because there's a huge difference. Okay, so you guys know my background, and if you haven't, just scroll back on a few videos, you'll know. Child, look, I don't even normally do my eyebrows like that, but I was like, let me just come on here without looking crazy, because like my eyebrows were looking crazy last time. Jesus, I should have just came regular. I'm sorry, guys, but I don't even like wear my eyebrows this thick. I don't know what got into me. Oh, Lord. See? But anyway, I just wanted to look halfway decent for you guys because last videos I didn't do any makeup. Okay, anyways, so for fundamental clinical, it was completely different, and when compared to MedSurg, to my current MedSurg clinical, the difference between funds clinical and MedSurg clinical is where you are. So funds clinical usually takes place in a nursing home, versus MedSurg clinical usually, and then the clinicals thereafter are usually in a hospital or acute care setting. For fundamentals, we went to a nursing home, and you guys know that I have CNA background, and I mean that's the main reason why I decided to challenge my CNA exam, which I have a video on that coming up, and how you can too and save yourself like over $1,000. But that's the reason why I decided to become CNA in the state of Florida, simply because I didn't want to just enter it and just be blindsided. So for Funds Clinical, we learn the basics, meaning it's fundamentals of nursing. You learn how to clean a patient, transfer a patient, um, make a bed, feed a patient, and just like that type of thing. So usually you're shadowing a CNA, and they're showing you their day-to-day operations, which in a way is really, really good because you get to see what CNAs go through and what they do and how many people they actually have to take care of. And so that way you can appreciate them just much more. Being a CNA, I appreciate all the CNAs. And so I'm always willing, even at work, I'm always willing to lend out a helping hand because I know, like, it's tough work. It's not easy. During Funds Clinical, you probably will be in there and be like, I'm paying insert X amount of dollars here that you're paying for your school. Why am I paying this much money to learn how to wipe someone's butt? I've heard that time and time and time and again. And the thing is, guys, fundamentals, you're learning the basics because let's just say, and this happens so frequently, if you're short on nursing assistants or you have a full census and you're working on the floor as a nurse and your CNA is responsible for like let's say 22 patients, the whole floor, you only have one CNA, and your patient has to be changed, and your CNA is doing like 2 to 3 things at once simultaneously. You think your CNA is going to have enough time to come over there and change your patient? No, you're going to have to change that patient yourself, or you should know or have the knowledge and the skill set to be able to change that patient. So that's why we go to funds, and that's why we go to the nursing home, is so we can build that skill set, and so we don't depend on the nursing assistants for everything. Because like in the ICU, I've heard this, especially for people who want to go into the ICU like myself. Um, the nurses do everything for that patient. Granted, they'll have a low patient to nurse ratio, but they do everything: bathe, wash, toilet, everything you can imagine. They do it because of their critical care unit. They rarely have CNAs on the floor. So that's something to consider when you're in funds and you're at the nursing home doing your clinical, thinking about, I'm paying $50,000 to wipe someone's butt. Think about that, girl, okay? Because I've worked with a nurse who, she was like, oh my God, I do not know how to clean a patient. And I just looked at her. I was like, I mean, did she really say this? But she did. And I was just like, okay. So that's fundamentals experience. You will be learning how to clean. And plus, I feel like that's such a good stepping stone to kind of like test your stomach and get over the squeamish things, because if you can wipe poop and clean pee and stuff like that, I feel like that's the easier part when it comes to nursing or nursing assistants. I think the hardest part for me is the transferring, simply because, like, if your patient's a total, you have to transfer them using your strength, of course, with proper body mechanics, but still, it's very stressful on the body. So that's my biggest thing when it comes to nursing and stuff like that, nursing assistants. Okay, so now let's transfer or cross over to MedSurg Clinical. All right, so MedSurg Clinical is going to be different. Oh, also in your Funds Clinical, you'll learn how to do your assessments. So like checking your blood sugars or your blood pressures, if that facility allows you, checking your vitals and stuff like that, doing head to toe assessments. And if you're lucky, and if you're smart, you can finesse your way to be buddy buddy with a nurse, and your nurse can show you everything that you need to know. That's what I did. Because, like, guys, I have a CNA license, so I knew what they was doing. So I was like, I'm not gonna sit here and watch you do this. I want to do something else. So I asked my professor. She said it's totally fine. So I decided to outsource or source a nurse, and I was like, "Can I shadow you for the rest of the day?" And she was like, "Sure." And that's what I did. Well, he was like, "Sure," and then she was like, "Sure." And I learned a lot from that. All right, now let's go over to clinical. So MedSurg Clinical is a big difference, simply because you'll actually be doing care. You'll actually be paired with a nurse or a nursing assistant, but more so a nurse. And you'll get to see the MRI in action, the medical administration record or med administration record or whatever. You'll get to see the care plans. You'll get to see the doctor's orders. And also, you'll get to, depending on your program, you'll get to assist in pushing saline. Okay, I didn't say like medication, but you'll get to assist in pushing saline. Looking at tubes. Like, you can do a lot in MedSurg Clinical. You probably can get injections depending on how comfortable you are. MedSurg Clinical is also where you would start inserting your IVs if you feel comfortable or whatever. Because in the lab portion of MedSurg, we practice IVs on the dummy hand. So and during this clinical, you may insert an IV. For example, I have clinical tomorrow, and I'm really itching to start an IV, so I might do one. Who knows? But like, you get to do more hands-on training, and you actually you feel like a nurse. I'm not gonna lie. MedSurg makes you feel like a nurse. You start to see, this is what I'm gonna do. These are gonna be my day-to-day operations and stuff like that. For my clinical rotation, we're at like a long-term acute care, so we're not at a hospital. And I chose that specifically because I wanted a more critical ICU type of center, and so hospital. So my clinical instructor paired me with the wound care nurse at first, and I'm pretty sure you're like, wound care. You guys, I was so amazed at what wound care actually does. They don't clean out like debris room. They don't do a debrisement of wounds. They're not at the bedside 24 hours like the RNs. Like, they have it pretty good, and I was like, this is something to consider, But it was actually really fun. I enjoyed it. I enjoyed the pace, and definitely like, you're working by yourself in a way. And so, although you may have the whole hospital to yourself, but still, you're kind of pacing yourself on your own time. I really like the flow of that. So, yeah, I really like the fact that my instructor did that, because I was like, okay, wound care is something to consider, and they pay very well for wound care nurses because they're such a vital part in the healthcare industry. Because, as you know, Medicare does not pay for hospital acquired pressure sores or impaired tissue perfusion. That's the new term. So hospitals, Medicare doesn't pay for that, or reimbursement. So a wound care nurse's responsibility is to make sure that when a patient arrives, that any sign of a store, whether it be stage 1, they document it and keep it there. That way, when we bill the insurance companies know that hey, patient XOXO came with that pressure sword. They didn't get it from us. You know what I mean? And I just really like that. It's like investigation work, but like, anyways, I really like that. I really enjoyed that experience. So, but back to MedSurg. Sorry, guys, I went on a tangent. But if you can shadow a wound care nurse, you'll be surprised. And I got to see some really cool wounds. Like I saw a live evisceration. It was disgusting, but I was like, oh my god, I want to see. And I assisted, and I held down the stomach, and I can feel the guts on my hand. And I looked at it, and what was it? His bowel? No, his intestines. It was so pink. It was just like the book. It's one of those things that you read in the book, and you're like, can this really happen? Yes, it can. It was awesome. It was awesome. It was awesome. It was awesome. I saw a stage 4 pressure sword that looked like a lion just like bit the person's back. It was at the coccyx bone, sacral area. And girl, it was disgusting, but still I couldn't look away. But he came to the facility with that sword, so it wasn't hospital acquired. As you can tell, there's a big difference between funds clinical and MedSurg clinical. Funds, they may have pressure sores, or they probably will have pressure sores in the nursing home. But MedSurg, you get to do a lot. You get to actually follow and do some of your, you get to do it. The way my instructor described it is that you get to do things within your scope of practice, an RN scope of practice. So if you're an RN, you can start an IV. Not you if you're an RN. You're practicing under an RN's license, so you can start an IV. You can give medications. You can crush medications. Like you operate within your scope. However, there's certain things that you can't do. For example, we can't go into a negative air pressure room because we're not fit for an N95 mask, and plus I wouldn't want to go in there anyway. You know what I mean? So just little things in that, little tips, or not tips, but just little things like that, the fine thing. But usually we can operate within what our nursing scope would be. So you get more autonomy in MedSurg because you get to do more and you get to see more versus funds. However, I will say this. If you're going to funds clinical right now and you felt like you're discouraged, like I didn't, pay all this money to come and wipe butts, try to maximize that experience and try to make it the most and ask the CNAs that you're following for tips and ask them for, things like that they've seen and, share the insight. But have an open mind and don't just say that, or don't accuse a teacher of sitting on her butt all day. Just those little things. Just don't be a negative Sally, okay? Or just a angry Betty. You know what I mean? Just don't be one of those. It's so annoying. And complaining about every little thing. Guys, truth be told, when you go to the nursing home, it's not going to be peachy clean. Staff, they're always low on staff. Oh, they're overworked, underpaid. So things you see in a nursing home, you're going to be like, oh my God, I can't believe it. But you'll start to realize, okay, this is why this is that case. Okay? So remember I said this. Remember I told you. So, yeah. Oh, also for my funds clinical, it was an 8-hour day versus MedSurg is a 12-hour day. 7A to 7P or 6A to 6P. But alrighty, guys, I hope you enjoyed my 2 clinical experiences thus far and can apply it to your clinical experiences. And I'll try to upload like a video on how to like make the most of your clinical experience and elaborate more on that. But more so, take those gems that I mentioned and just think about that and just have a positive mind, and then you'll be good. I promise. Okay. So thank you so much for watching my video. If you want, definitely drop down a pill emoji or a syringe. Sorry, guys, I did not mean to flick you off. Or a syringe emoji. And it was really nice talking to you guys. Bye-bye.